Joining us now in our newsroom, we have Dr. Amy Beth Kressel. Hello, Dr. Kressel. Great to have you here.
Thank you, Mary. Thank you for having me.
So we have the coronavirus shots are rolling out. And the question is, what happens when we get injected with this shot? We know that this is the makeup of this coronavirus vaccine is an RNA vaccine. It does not include any live pathogen antigens from the coronavirus. And specifically, it contains the genetic material for the spike protein, which is very important to the coronavirus, among a couple of other ingredients. So specifically, what happens when a person gets this shot? When this genetic code is injected to their body, where does it go? What is it attached to? So take us from there. What happens first?
Right. So what they've done is they've taken only one gene of the virus, not the whole virus itself, but just that spike protein. The spike protein is kind of what the virus uses to latch onto your cells to get in. If you can make antibodies to that latch-on protein, the spike protein, then you will be protected against the infection. So they take that small piece of DNA, they put it in an envelope of lipids or fats, they inject it to you. That package will enter your own cells. Your own cells will actually start making spike protein. And then that spike protein is recognized as something that doesn't belong to you by your immune system. And then you will make antibodies to that spike protein, protecting you from future disease. That it doesn't stay long. It enters your cells, but is cleared away pretty quickly. It does not enter into your cells in a permanent way. So basically, it's there long enough to make the spike protein and generate the immune response.
So specifically, do these attach to all of the cells in our body? Do we need just a specific amount of cells for it to attach to?
It attaches. It enters cells in general. It doesn't have to enter all the cells. Like I said, it just needs to enter enough to start reproducing itself, and then making enough spike protein that the body can recognize and then clear.
So the vaccine is injected. Or the vaccine with the spike protein genetic material is injected. We then have our body recognizing this spike protein as a foreign agent. So then our body goes to take a look at that foreign agent and then really does the work on its own, like what we're sort of designed to do as having an immune system when we recognize something. So yes,
correct.
Please.
And what goes on here is that it basically, when this happens, not only is your body seeing the spike protein itself and making antibodies, but it recognizes the cells that are making the spike protein as also being infected. So it's actually engaging multiple arms of your immune system. It's been shown that if you can think of your immune system as having two basic kinds of responses, antibody responses, but also T cells that also respond. And those T cells can stay around. And so this vaccine activates both the T cells and the antibody making cells to make that immune response.
Mm-hmm. And you had said from what I heard, this is temporary. This is a transient type of activity. So can you explain a little bit more in terms of what that means?
Basically, your cell will be infected. I don't want to say infected because it's not a virus, but you will have cells with this piece of the virus gene in them. Again, not the whole virus gene, just that small piece. They will turn into factories making that small virus piece, the spike protein. And your body recognizes that those cells, something has happened to them, that they're not behaving the way they are. So again, you're going to have multiple components of the immune system stimulated, both against the spike protein itself and those basically cells that have been taken over. This is a little bit akin to what might happen if you got the actual infection, in that your body would recognize that cells are making something they're not supposed to make. So it's not just you're injecting a foreign substance into yourself, you're actually, if there's a recognition that your own cells are infected or affected, I should say, since it's not a true infection. So you're getting a very vigorous immune response.
Mhm.
And then your immune system will basically clear away both the actual spike protein as well as the vaccine.
Wow. Yeah, I think I've just been getting a lot of questions about what happens to my body once I get this, what's actually happening to my body when I get this coronavirus
Now
vaccine.
remember when, I'm sorry, I don't know if you hear my computer buzzing. Now remember when you get sick from any kind of infection, right? Something similar is happening. Your body is recognizing both the virus itself and parts of your own body. I'm sorry, I'm being very inarticulate. Sorry, can we?
No,
can we
you're
just-
fine. I understand what you're saying. Yeah.
Yeah, I. It's only a very tiny fraction of your cells that are turned into making the spike protein. But again, that is enough that your immune system is turned on. It recognizes this. And it's kind of like training wheels. If you've got the actual infection, then your body says, oh, wait, we've seen this before. We've seen the spike protein before. We've seen cells making the spike protein before. We know exactly what to do. I think the data that was presented to the FDA for the vaccine was very persuasive, that it was very highly effective in preventing disease from COVID, and very effective in preventing severe disease, with a very favorable safety profile.
That's great. Well, thank you so much. I really appreciate your time today, Dr. Kressel.